Heart attack, stroke, and a number of other serious long term health conditions are linked to smoking cigarettes. And unfortunately, a recent report found that almost 15% of Adams County residents currently smoke. But the good news is there are resources available if you're thinking about quitting. I'm Laura Wheatholder. I'm a registered nurse and community outreach coordinator for Blessing Health System. I'm joined today by nurse practitioner Leah Hemming with the Blessing Cancer Center. Leah, thank you for joining us. Can you take a moment to introduce yourself?
Yes, thank you for having me. My name's Leah Hemming. I am a certified nurse practitioner with the Blessing Cancer Center. I've been at the health systems a little over 23 years and with the Cancer Center since the day that we opened.
Well, great. Thank you so much for joining us today. Now, most people know there are a number of health risks linked to smoking, but some might not realize just how many conditions are linked to smoking cigarettes. I think we all just instantly think lungs, but can you expand on the many risks associated with smoking?
Sure. As you said, smoking has a lot of risks, and not just to the lungs, but obviously the lungs are probably the most popular, the most common thing that cigarettes and nicotine affect. But nearly all body systems are affected one way or another as a result of smoking. But some of the most common diseases include heart disease, lung disease, stroke, and cancers. The CDC estimates nearly 500,000 deaths each year directly related to cigarettes. So, 90% of all lung cancers occur in patients who smoke, and smoking causes 80% of all deaths from COPD. It also increases the risk of developing coronary artery disease, and strokes are 2 to 4 times higher. Um, uh, Higher, and it increases the chances of lung cancer risks by 25%.
Well, those are some pretty staggering statistics, all associated with smoking. Now, one of the things, that's I guess a little bit more newer on the market is vaping. Are there vaping and other smokeless tobacco products, e-cigarettes, things like that? Are there similar health risks associated with those type of products?
Yeah, great question. The consequences of like chronic e-cigarette or aerosol inhalation are largely unknown, but there are high levels of toxins and carcinogenic compounds that vary depending on the type of e-cigarette liquid components and the device that's used. But overall, the long-term cardiovascular risks of e-cigarettes use are unknown, but they're thought to be substantially lower than the risks of smoking.
Okay, so but still a lot of maybe uncertainty in that area.
Right.
Now, when you make the decision to quit, the benefits are actually, it was kind of interesting to learn that the benefits can be almost instant. Can you talk about the health improvements someone might experience when they make the decision to start to quit smoking?
Absolutely. And a lot of this information is on the Blessing Health System's Quit Smoking benefits website. But 20 minutes after your last cigarette, your heart rate and your blood pressure can return to a lower normal rate. And a few days later, carbon monoxide levels in your blood can drop to a normal level. So that's incredibly promising. 2 weeks to up to 3 months after your last cigarette, your circulation improves, your lung function increases, and then anywhere from 1 month to 12 months after your last cigarette, coughing and shortness of breath decrease. There's little tiny hair-like structures that move mucus around throughout the lungs. They start to regain normal function. Those are called cilia, and they increase their ability to handle mucus, clear the lungs, and reduce the risk of infection.
So, a lot of benefits when you quit smoking. But making the decision to quit smoking is just the first step. So, what tips or suggestions do you have for someone who's ready to quit? It's not necessarily an easy process. What do you recommend?
It's definitely not an easy process, and it's not one shoe fits all. It needs to be customized to every patient and what they have going on. The first step is always the hardest, and I challenge patients: do you want to quit? So ask yourself, do you want to quit? If the answer is no, then now might not be the time to make quitting efforts. I'm a former smoker. When I would hear people talk about how I needed to quit smoking, I would often shy away from the recommendations because I didn't want to hear it. I didn't want to be done. But it was something that I've enjoyed, and I had no intentions of quitting at the time. However, after so many repeated comments from my friends and family, I really started to take a look at my own health and what I could do to control my life. There are certain things that I can't control, such as I have a strong family history of heart disease on both sides, early heart disease, in fact. I can't control my genetic makeup, just as I can't control the color of my eyes. But what I can control is what I expose myself to. So I had to have a conversation with myself about what's most important in my life, my friends, my family, my job. And I realized that none of those things would exist in my life if I was no longer alive to enjoy them. So was it easy? No. Was I tempted to cheat? Absolutely. But I had to come to the realization that I was in control of myself. Only I can control what I will and won't allow. And if you want to quit, there are several options that your doctor can help you with or recommend. Many patients have success with quitting cold turkey. It's what's worked best for me, but it may not work best for others. Another option would be to pick a quit day, along with the use of a smoking diary, which can help. A smoking diary is similar to calorie counting. Each day you write down the time of day for each cigarette that you smoke. This helps you to become more conscious of the habit. For example, think of it like blinking. We blink 15 to 20 times a minute. And until this moment, you didn't even realize you were blinking until I mentioned it. But now you became more conscious of it.
D-
So keeping a smoking diary simply makes you more aware of the act. When you can set a goal to decrease your pattern by a set number each week, and then until cessation or until you complete your finished smoking is achieved. Another tool is to tell yourself that you're no longer a smoker. Picture yourself as smoke free and then calculate how much money you'll save at the end of the week, at the end of the month, or at the end of the year. One pack a day is over $2,500. Another important tool to remember is behavioral therapy. It can be extremely helpful when kicking any type of addiction, especially smoking. Counseling can be critical to the success of tobacco dependence treatments in either individual or group setting. Another thing to remember is to keep ways to keep your mind and your hands busy. When the urge occurs, distract yourself by going for a walk or knitting, journal your cravings and how those cravings make you feel, whatever it is to distract you. It's kind of Pavlovian in conditioning to retrain your mind and your craving. Another important thing is to educate yourself. As with anything in life, when you're at a level of interest or desire to change drives your willingness, learn why and how you need to change. There's a really good book called Quit Smoking Now by Alan Carr. I've purchased several of them here at the Cancer Center. It's on Amazon. It's less than $15 and it's available on audio. Listen to it once, listen to it twice, listen to it as often as you need to in order to help quit smoking. Another good tool is to watch YouTube videos from other people that had had success in quitting. The CDC has a really good YouTube series called Tips from Former Smokers. It's got people as young as 20, 30, 40 on up of have what tools that they used or the mindset that they used in order to have success with quitting smoking. Something else to consider is tell everyone close to you. Tell your friends, your family, your coworkers, tell everybody that you're quitting. And then they can all be your accountability partner. Let them know what your quit day is and ask that they check on you on your quit day, the day after, the week after, the month after. In fact, you never know who you might be inspiring.
So that is a ton of great recommendations, a ton of great resources. I love sharing your quit day and maybe asking people to help hold you accountable or just to be your support system. That's really, really important. Beyond those recommendations, there are so many products available now that can help an individual quit. There's gum and patches, even prescriptions. Do these help? And when should somebody consider using that type of product?
Right? That's a great question too. Anything can work if you want to quit smoking. So that's number one. You really have to have that conversation with yourself. Do you want to quit smoking? But in addition to the interventions that I mentioned previously, there are several types of medications available: gum, patches, nasal sprays, pills. These options are best paired with behavioral therapy, though. And keep in mind all medications come with side effects, but behavioral therapy, in addition to those systemic therapies, can be successful in some.
So I think, like you said earlier, going back to earlier in our conversation, what you said is there's no one size fits all.
Right.
Those behavior change modifications, the tips and tricks that you kind of talked about might work. You might need a smoking aid, but figure out what's going to work for you, and but you first have to commit to it.
Right.
I recently read, and this is hopefully not discouraging for anyone, but I recently read that smokers may try to quit an average of 30 times before they're successful. What suggestions do you have for anyone who has maybe tried to quit in the past but wasn't successful? They want to commit to it this time. Is there anything that you can offer them?
Yeah, that 30 times, it does sound like a lot, but when you think about it, how many times have we gone on a diet? How many times if we ran a race where we're constantly trying to beat our PR? I know myself, I've had that conversation with myself many, many, many times, many years before I was successful at quitting. So I think that's pretty accurate. The bottom line is aim for persistence, not perfection. If you constantly go with a mindset of doing better tomorrow than you did today, you have nothing but success to aim for.
Oh, those are great, great tips. Is there anything else that you would like to add to the conversation today? Anything that maybe we didn't talk about that you feel like is important to share with anybody who's thinking about quitting or ready to quit?
Yeah, I mean, if you're having those conversations with yourself, I think I want to quit or I need to quit, what can I do? Talk to your doctor about it. And then surround yourself with other people who have had success, who have gone through the same struggles. There's some beauty in numbers, and you find out what works best for you. It's not maybe what works best for your neighbor or your friend, but what works best for you. And saturate yourself with knowledge.
Well, all great advice, and hopefully somebody out there listening can and find the motivation and maybe the resources they need to be successful in quitting. So, thank you so much for joining us today. And if you are interested in more tips and resources to help you or someone you know quit smoking, you can log on to our website, blessinghealth.org/quit smoking. Thanks again for joining us.
Thank you.